Good morning, everyone, and welcome to our exclusive update, behind the scenes, intriguing, amazing, exciting expert panel discussion this morning. We are having a bit of an overview from Barwon Health for our volunteers, community groups and fundraisers. My name is Zoe Waters and I'm very proud to be the Executive Director of the Barwon Health Foundation. And before I introduce you to our wonderful webinar panel, I'd like to acknowledge the traditional owners of the land on which we meet today, the Wadawurrung people of the Kulin Nation, and we pay our respects to elders, both past, present and emerging. And of course, we welcome any Aboriginal or Torres Strait Islander people here with us this morning online. I'm thrilled to be joined by a wonderful expert panel today for our webinar. Kate Gillen, Chief Nursing and Midwifery Officer from Barwon Health. Good morning, Kate, how are you? And we've got Therese Clark, Paediatric and Young Adult Services Coordinator. How are you, Therese? Give us a wave. We've got Dr. Richard Grills, Director of the Department of Urological Surgery. Richard, how are you with that interesting piece of machinery there? Welcome. And we also have Claire Eates, who many of you will know as our Community Fundraising Manager at the Barwon Health Foundation. Good morning, Claire. And also my wonderful colleagues from the Barwon Health Foundation in Francis, Danny, Hayley, Sarah, Sherry, all who of which are online. And before we start formally to hear from our expert panel, just a couple of webinar housekeeping items. We are going to be recording this webinar for our colleagues who weren't able to attend this morning. So please keep the language friendly and appropriate at all times. We would love for you to ask any of your burning questions by clicking on the chat button on your screen. Please mention the person that you would like to respond to your question, or you can of course click the raise my hand button and we will cross to you live for your question. We unfortunately cannot see your faces or hear you, only those of our panel. So please make yourself a cuppa, pop your slippers back on if you have got them under the desk, and settle in for what will be a very informative hour. Of course, if we don't have the answers, we will certainly take them on notice and get back to you. But most importantly, I would like to welcome each of you, our community groups, community fundraisers and volunteers who are indeed the fabric and the DNA of the Barwon Health Foundation. You are the very connection that our local health service has with our community, and you are the people who work so hard to advance your local health service. It truly is a real honour to give you an update, an exclusive update from Barwon Health and the Barwon Health Foundation, and chat about what we've been working on during what has been such an interesting, challenging time, and quite frankly, at times frightening. For those who have not connected with the Barwon Health Foundation before, we are the charity arm of Barwon Health. We aim to create happier, healthier lives by investing in the life-saving and life-changing work of Barwon Health. We unite to fund and enhance Barwon Health's exceptional standards of care, and we allow Geelong and the surrounding regions to help themselves, but most importantly, to help others. Whether that be through returning the favour following a wonderful episode of care, to leave a lasting legacy and bequest in a will, or to simply do good. We work with our community to support Barwon Health to provide the very best care. So if you told me 12 months ago that we'd find ourselves here on Zoom, a program that I'd never heard of before, but now I wish I had many, many shares in, to talk about the most challenging health crisis Greater Geelong has faced in over 100 years. I would have perhaps told you were kidding me. If we take a look back to early March, Greater Geelong was a very different place. We roamed around the region and indeed the country freely. We visited, hugged, even kissed, which sounds so foreign now, our loved ones. We planned overseas and interstate adventures. We held fundraising events with thousands of people. We visited our friends when we wanted to. We volunteered, and masks were only worn by surgeons like Dr. Richard Grills. In March, the Barwon Health Foundation launched Victoria's first coronavirus emergency response fund. And with thanks to you, passionate locals in Geelong, the fund would go on to be the most successful fund across the state. The Geelong community rallied like no other to raise more than $1 million to help Barwon Health to prepare for our local response to COVID-19. 50 hospital beds were donated thanks to the Percy Baxter Charitable Trust. 49 vital signs machines thanks to a local anonymous family. 10 aged care beds were donated in memory of a well-known local businessman. 2 resuscitation trolleys were donated thanks to our friends from Rotary. 15 iPads, ICU defibrillators, hundreds of COVID patient care packs, and the list goes on and on. But what really blew us away was the community's care, gratitude, and concern for our healthcare workers. More than 5,000 cups of coffee were shouted to Geelong locals by Geelong locals. One local family donated more than 2,000 meals, which were made for healthcare heroes by Truffle Duck. And we cannot even count the number of hampers, gifts, small tokens of appreciation that were donated to lift the spirits of our healthcare workers. It's fair to say that our healthcare workers certainly felt the love and support from our local community. And then Geelong went dry, drier than we'd ever experienced. Kate Gillen knows just how dry. 279 people, including Kate and the CEO of Barwon Health, Francis Diver, all went dry, raising more than $140,000 to support patients being treated for cancer at Barwon Health. So thank you, Kate, for taking part in this year's Dry July. And then we received a phone call which completely blew us away. It was a phone call from the Costa family, a local iconic Geelong family who already do so much for Geelong. It was confirmation of a $2.5 million donation to fund the establishment of regional Victoria's first dedicated clinical trials centre, named in honour of their late brother, Adrian. The Adrian Costa Clinical Trials Centre will quite literally provide hope, advance research in Geelong, and save local lives. We thank the Costa family for their leadership and for their love of Geelong. And if we fast forward to October 2020, some will say the world may never quite be the same again. To talk us through Barwon Health, how Barwon Health has responded to COVID-19 and how our health service is now positioned to respond to any further impacts of COVID-19, I'm very proud to introduce the Chief Nurse at Barwon Health, Kate Gillen. If we can unmute Kate, we've got a couple of questions, Kate, that were submitted in advance for you, and I'm hoping we can kick off our chat by answering a couple of those, if that's okay.
That's fine. Hi, Zoe. Hi, everybody online.
Thanks, Kate. Now, Kate, the first question that came through is, Kate, what a year it has been for Geelong. How has life at Barwon Health been treating you as the Chief Nurse at Barwon Health during what would arguably be the most challenging time to be Chief Nurse?
It has been a really challenging time. That's a good word. We did, in September 2019, experience, along with health services right across Gippsland and Barwon Southwest region, a quite targeted ransom cyber event, which took out all of our computers and emails, and a lot of our software was corrupted, and we had a very significant challenge getting ourselves back in operation. And then as we were normalising and finding business as usual, we in the January started to experience the really early indications that we were in for a really difficult time right across the world. And the pandemic, I guess, was just starting to emerge, and we've seen, as everyone's experienced, we've seen a most extraordinary time. And so for health, we're leaders in this space, and the really important piece for us is that we understand exactly what's happening, and there's a lot of really new information to understand. It's a new virus. It functions differently to anything that we've seen before, and so a lot of that learning and understanding and responding was really done on the hop. And so the important piece about that is that we really needed to pull together and have a coordinated effort. And so some of the positives about that is that it creates high resilience within our teams. And I think without exception, people would say that they have done things that they never thought they would need to do in their work environment and in their home environment. But that also gives you a confidence that we can manage just about anything. And And also, I think one of the other positives is that it's real bonding time within Barwon Health, and also across our region. So Barwon Health is the regional lead within the Barwon Southwest, and there's 16 other health services, all smaller than us. And so it was really important with the colic outbreak, for example, that we partner with them and support them in that very significant work around testing and supporting their community. So you're right, Zoe, a challenging time, really busy time, but a lot of positives have come out of it. And I think what you've seen in some of the media that's come through is that Barwon Health have performed really well. On the 7:30 report, I think we'll get again mentioned for the contact tracing that has really been outstanding, and it's been a real local response. So we've been able to understand what's happening locally and be able to respond really effectively.
Absolutely, Kate. And it's clear, you know, we've had some really positive results over the last few days and indeed, you know, few weeks with cases dropping to what has been zero. This virus is going to be here for the long haul, isn't it? What do you think will be the biggest health impacts on our local community?
Yeah, so we're learning. We've learned all sorts of different things in the last 6 to 8 months. We've learned about social distancing and the public health messages that have been really important. And Geelong as a community has responded just really positively and effectively, and that's evidenced by the way in which we've been able to get across when we've had outbreaks, which we have had outbreaks within our region. We've been able to contain those really effectively and work together as a community to ensure that we're responding to all the public health messaging and keeping things at bay as much as possible. So we've learned a whole bunch of other things, and we know that those things are going to be in place for us for the foreseeable future. So the mask wearing and the social distance and being really conscious about who we have contact with and doing that in a safe way. But we're also really conscious of that as a health service, we have been very focused on the response to this virus, but that's a very small part of the whole work that we do here as a regional leader, but as the major hospital and health service within Geelong. So we need to make sure that we're monitoring really closely that people have got good access to care. We hear on the media about people who aren't going to their GP or to the ED or wherever they need to go to make sure that they're getting their healthcare needs sorted out. And we just really encourage people to make sure that they're accessing all their usual services. They're all in place. And also the other really important message, of course, is that we're taking care of each other and really conscious about looking after ourselves emotionally and mentally, and putting that extra focus on making sure that we're staying well, we're staying connected to people, and that where we've got situations where isolation could become an issue, that we're trying to just get things in place so that we have those connections and that we're caring for ourselves and each other.
Kate, you're there at the hospital at the moment, University Hospital Geelong. What's the vibe across the nursing team? You must have thousands of staff under your leadership. How do you feel they're coping as time goes on? This has been around for 7 months now. It's a long time.
Yeah. Well, always initially when you have a crisis situation, people pull together really effectively, and that's a little bit sort of us against the virus feel. But this has been the long term, as you say. And so the really important piece is that this is that we sustain our energy and we sustain our focus And so what we're really encouraging people at the moment is to take a little bit of time out. It's great that we've been able to open up and be able to go locally and enjoy some of the beautiful region. And so we're really encouraging staff to do that, because it has been a long haul, and people have been doing, sort of doubling their efforts in the work that they've been doing. So really recognising that, sending that message of support. And so it's just really important to touch in that there's those messages that you mentioned that came through from the community it was just a really profound effect, that people within Barwon Health felt really supported, and they really felt that the community was behind them. And that makes a really big difference in such a time of uncertainty. So thanks to all those online who have been part of that, but also to the wider community.
Thanks very much, Kate. And just a reminder, if you've got any questions for Kate, pop them in the chat box, or you can press the raise your hand button and we can cross live to you. Welcome to those new volunteers and fundraisers who have just joined us as well. Now we are crossing over to Therese Clark, who has a very exciting project that we're very invested in. We're around $3.6 million invested in the Kids Appeal. The team and I launched the Kids Appeal a couple of years ago now, and we're pretty excited about it. We've raised $3 of the $3.6 million needed to build a dedicated, designed for the youth and children of Geelong. So Therese, over to you. Can you tell us a little bit about how we're going with the project?
Absolutely. Thanks, Zoe, and thanks everyone for joining in today. Many of you, I'm sure, who are online, I've met before, and no doubt we'll meet again when we're allowed to be face-to-face and hopefully open this exciting brand new centre. So one thing that COVID-19 hasn't derailed this year is our commitment to getting this project moving. And even though fundraising has been really hard with many events not being able to go ahead, despite that, we've still had amazing support from the community, both financially and personally. And it's because of that unwavering commitment that we're able to go into basically designing this new building this year. The money is there, which is fantastic, almost there. And we've been given the go-ahead to design. And I can tell you it's lifted our spirits this year when things have got hard, to know that the community is still out there, still supporting us. And it's also lifted the spirits of our families who, you know, have been finding it really challenging and hard for lots of different reasons. So this year, the project team, including an amazing, I've got to give them a shout out, an amazing group of people from Barwon Health's Capital Works department, have pushed ahead with the schematic design and the detailed design of the new build. We were lucky enough to do our co-design with our families last year, and we've used that information to really develop both an indoor and outdoor therapy space, which is, I think, going to blow everyone away when we've got it built. So all of that's been done virtually. We've all discovered WebEx meetings versus Zoom, and we've been able to meet with all of the design groups, with landscape architects, with building architects, with service engineers, a whole group of people that I never knew existed. And we've pretty much finalised the detailed design, and it will go to contract documentation, another word that I've learned over the last month or so, with hopefully on track to commence the building in 2021, which is pretty exciting news for us. We've been around since 2009, operating out of an adult rehab centre, which, although is a great facility for adults, is not the best situation for young people. And this is all thanks to you, all thanks to the people who've supported the appeal. Big thanks to the Barwon Health Foundation, who have just embraced this appeal and really helped us get, you know, close to every bit of every cent that we need to squeeze out to make this an amazing space for young people. And we wouldn't be able to achieve the success without the support of the foundation, but without the support of the people who support the foundation. So everyone online and everyone who couldn't get online today. It just feels like a big warm hug from the community to our children, and they very much are aware that the community are doing this for them, and it's a really can't underestimate the power of that when you're a young person who's just had a stroke or a traumatic brain injury or a spinal cord injury, and life's tough, to know that there's a group of people out there who are raising money for you to get somewhere that you can go that's fun and engaging is amazing. So 2021 is going to be a big year for us. I'm convinced, I'm very confident that we'll be awarding tenders for builders, and we'll be building buildings, and I'll be gazing at the green space slowly transforming itself into an amazing building and an absolutely amazing outdoor therapy space. And that it'll be tangible proof that together as a community, we can come together and achieve really amazing things.
Therese, I've got a question here from one of our online guests. Can you talk us through who is the recipient of your service? So I assume that question means, what types of conditions do young people and children have when they come to the VPRS?
So since the beginning of this year, we've had about 158 young people through both our paediatric rehab service and our young adults transition service. So many of them may have had childhood strokes, traumatic brain injuries, severe concussions, spinal cord injuries, brain infections like encephalitis and meningitis. So many of these kids are just like yours and mine, or your neighbours or your grandchildren, who were typically young people who, for some reason or another, have had some new injury or new condition that's really changed their lives, and they've had an acute hospital stay and had excellent treatment to get them well enough to come home and go back and doing the things that young people do, which is go to school and go play sport and do dance, and we're there to help those people achieve those goals. So they come to us, and they're going to come to an amazing new centre which is designed just for them, which is engaging and fun, and it's an adventure, and it makes things that are hard just that little bit easier. So if you're trying to learn to walk again or talk again, or learn how to communicate and play with your friends again, those things are tough, and they're not things that are usual activities of childhood. So if we can give them a place to be that's fun, exciting, engaging, is an adventure to be there, it'll just be that little bit easier for them to be able to get through that journey with us.
Therese, the Bendigo Bank Collective across the region, the Community Bank Branch Network, and also our Women and Our Children volunteers have funded a lot of the outdoor, what was called a play space, but you've corrected me in calling it an outdoor adventure space. Could you talk us through how you will almost be disguising rehabilitation through an outdoor environment?
Absolutely. Look, we live in a coastal area where outdoor play and outdoor fun is a key aspect of what young people do. And a lot of the young people that come to us have issues actually in negotiating outdoor spaces. So they may have some balance issues or some weakness in their arms or their legs, some paralysis in one of their arms and their legs, and actually getting into those outdoor spaces in the community is really tough for them. They can't do it. And it blocks out half of a large part of their childhood. So our outdoor therapy space is designed to allow them to practice some of those skills that they will need in the community, but it's not that traditional, I'm going to go on the slide or I'm going to climb a ladder. It's actually much more exciting and engaging than that. It's like an adventure. So what we'll find in that space is lots of paths that have uneven surfaces on them, lots of rocks that you have to climb, lots of wood and totems and that you have to step over. It's much more about exploring spaces and having fun in them whilst practicing a skill that you don't really realize you're practicing. So what we know with kids, we have to be a little bit sneaky. They don't want to do the same thing over and over and over again. They want to explore and have fun. So it's really a natural, organic space where you'll be able to explore and have fun without thinking you're doing therapy, because no one really wants to do therapy, not even adults, but especially not kids. So we have to make it fun and we have to disguise it. And we've worked with an amazing landscape architect who's embraced that vision. So you won't find one traditional piece of play equipment in this outdoor therapy space. What you'll find is lots of zones and of fun activities that kids don't even realize they're doing therapy. We're really excited about it.
So exciting that we've actually got some of, hot off the press, some of the drawings of the outdoor therapy space. We might actually bring those up. Now, anyone that knows me knows that I'm not IT savvy. Thank you, Frances Trainer, for bringing those up. Therese, chat us through some of the key aspects of the outdoor space that we've got on our screens right now.
Okay, absolutely. So without being able to control the cursor, when you see all of those light tan bits, they're all different pathways around this outdoor therapy space. So they'll be a mixture of surfaces, essentially. So that's the one, whoever's got the cursor. So that's a little track around all of the gardens. So it can be used for scooters or bikes or wheelchairs. But what it has is some rises, some falls, some different textures to simulate more what you might find in a real environment. Over in the top kind of green corner with the brown on it, other side, I can see someone with their cursor. No, down a little bit. Oh, yes, that's it. Over in this area, we've got, if you can see, the grass is all different type of mounds. So it's not a flat surface. So it actually practices uneven surfaces. And where all the brown is this absolutely amazing, exciting log trail that you have to climb under and over and step under and step over. So it practices a lot of those skills around balance and strength and bending. You go up that kind of hill and you find a really great little cubby house that has things that you have to climb through and climb under to get in there. So it's not your traditional cubby. It's actually much more kind of exciting than that. And then there's all of the borders of the grassed areas are either different stumps or different rocks of uneven heights and surfaces that children have to climb over or clamber over. Down in the bottom corner, we've got some steps, we've got sand, because one of the things that lots of families want to practice and get more confident with is actually sand. A lot of people go to the beach, and so this is a nice, safe environment to practice those skills. And smack bang in the middle, we've got a little basketball court. One of the things that we know with our adolescents is sport's really important. So we've got a court there that we can use for lots of different purposes. Now, I'm probably underselling this area because I'm not a physio or OT, but all I can say to you is that we are bursting our skins to get into this space. We are so excited about it and can't wait for it to be built. And every time we see it, we go, can't we just start it without the building? Can't we just start it? Because it's just going to be so exciting. And we have showed this to some of our families and they're just can't wait to actually bursting to get into that space.
We've got a question online here, Therese. It's from Joe White, who is a fellow Rotarian and also a patient transport volunteer. Thank you for your question, Joe. Where will the centre be built?
So it's built at the McKellar Centre, and not sure how familiar people are with the McKellar Centre, but there's an area of green space near the existing adult community rehab centre, just between there and Blackiston Lodge, which is an open green space, and that's where it's going to be built. So close to the existing community rehab centre. Obviously, we work quite closely with some of those. And the plan for this centre is that if we've got adult clients who have younger children and they'd like to do some more therapy that involves those younger children, that they'll be able to access this space as well. So it's not just for, it is primarily for our services, but we'll have the capacity in this space to accommodate some of those more family therapy that involves younger children with adult patients.
Excellent. And as you can see on the slide that we've got up on our screen at the moment, on the right-hand side, you'll see our donor boards. That will list the name of all of our supporters, our major supporters who will bring this new centre to reality. It's very exciting. I think we join you in your excitement, Therese, and we cannot wait for the first sod to be turned. Online, we do have Narendra, who's been a fantastic fundraiser for the Kids Appeal and his family. We thank him very, very much. We've got Lions Club, we've got Geelong Cross Country, we've got a number of Rotary clubs and a number of individuals who have supported the Kids Appeal as well. As I said, we've raised 3 million of the 3.6 million. We are so excited to be able to turn the first sod. And Therese, we thank you so much for being here today. Anyone that's got any questions for Therese, please post them online and we'll come back to them. But now we're going to cross to probably one of the biggest advocates for men's health in Geelong, Dr. Richard Grills, the Director of Urological Surgery at Barwon Health. Richard is on location at University Hospital Geelong, and we're excited to hear about a new piece of equipment that now is commissioned, which was 100% funded by the community, many of which who are online today in Libby Bate from the Cancer Aftercare Group, the Rosemary Norman Foundation, the Gentlemen's Club of Geelong, Geelong Racing Club, and the Mailbag Foundation. Richard, can you tell us a little bit about that whiz-bang machine you've got next to you? And Richard is just running to unmute himself.
All right, I'm just not sitting in front of the computer. Thank you, Zoe, and thanks for the opportunity to talk about this machine, which, as you said, was completely funded by donations with the assistance of the Barwon Health Foundation, who brought it all together. So this equipment to my right may not look much, but it's about $200,000 worth of equipment, which has made a real difference to the way that we diagnose prostate cancer in Geelong at Geelong Hospital. In essence, this machine has made the diagnosis of prostate cancer, a condition which affects about 1 in 10 Australian men, and of course has the flow-on effect of affecting children and of those people, and partners of those people, and parents of those people, etc., etc. So it makes the diagnosis of prostate cancer more accurate and safer. It makes a real difference to the way that we manage patients with prostate cancer. And as you pointed out, there are 5 groups that have made this possible: Mailbag Foundation, the Cancer Aftercare Group, Gentlemen of Geelong, the Rosemary Norman Foundation, and the Barwon Health Foundation, the Geelong Racing Club, from the Father's Day event we did there last year. So how this machine actually works, and we've got a slide, Francis, that explains how this machine works. You can see the machine there in the centre of the picture, and on the left of the picture you can see that it shows the ultrasound probe being inserted and the needle being inserted into the prostate to take a biopsy or a sample of tissue from the prostate gland, and that goes through the perineum just in front of the rectum. That enables us to get a really good picture, and on the far right you can see that's the image that we see. And far on the bottom left is the probe, which is put on a gantry or a grid, which is attached to the the operating table in the operating theatre. So that slide there explains exactly how this machine works. Now, we've all obviously always been able to diagnose prostate cancer traditionally with a different type of machine, but the way that we've done that has an increased risk of infection when we diagnose prostate cancer, and not quite as accurate. So we've always been able to do biopsies, but not in the same way as we've been able to do with this machine. We've been advocating with the hospital and trying to get this machine probably for 3 or 4 years almost now. But look, it's, you know, for capital equipment like this at the hospital, it's pretty tough. We've some time ago, we were approached by, initially it was the Mailbag Foundation, which kickstarted this, because the $200,000 was a little bit of a bridge too far for us to independently raise those funds. It's an awful lot of sausage sizzles at Bunnings, and we couldn't quite see that was going to do it. So Mailbag kicked this off, and they're an advocate, a fundraising group with advocates that their fundraising thing is this. This is what they do for hospitals around Victoria. That foundation was put together from individuals that were affected by prostate cancer that understood the importance of this machine to diagnose not just more prostate cancer in people that we were missing with the traditional biopsies, but also to do it safe with less risk of infection. And most importantly, this machine, due to its increased accuracy, allows us to choose the treatment option which is more appropriate for patients that we've been able to use before. So it takes for us as clinicians a little bit of the guesswork out of it. At Geelong Hospital, Barwon Health, we've got a fantastic prostate cancer service. We're the only regional hospital in Australia that has a robotic radical prostatectomy service. We've got a fantastic collaboration with oncologists and radiation oncologists through the Andrew Love Cancer Centre. We've got a multidisciplinary team meeting where we discuss all our complex cancer cases. We've got prostate cancer care nurses, similar to breast care nurses. So we've got a really good integrated system. The one thing that we didn't have was a machine like this. So this has made a real difference. We've had this machine for about 10 weeks now. We've managed about 50 patients with this machine. It's a machine that we've had in the private sector in Geelong for a couple of years, but all of the urologists in Geelong as one, we united in really advocating for equity of access with patients with prostate cancer. Shouldn't matter whether you've got private health insurance, not everybody should have the same opportunity, the same accurate, safe diagnosis of prostate cancer. So this has been a really fantastic collaboration with the Barwon Health Foundation, which brought together a whole lot of groups within the community and individuals to purchase this equipment. So if you don't think as a small community group or as part of the Barwon Health Foundation that, you know, well, what difference does my contribution make? This machine actually shows that it does. We had the Mailbag Foundation that kickstarted to say, yep, look, we can provide some money, which that $200,000, that's a start. It's enough of a start to build on. And they were, I guess, and they came down and we had a dinner and they did a ride on their motorbikes in the local area and drummed up support. We had the cancer aftercare group that came in on top of that with a significant amount of money that said, yep, look, this is something that we think we can support in line with our values. And then it said, okay, we've almost got there. We needed a little bit more. And I did a talk to the gentlemen of Geelong, a fundraising community group that kicked in some more. We did a lunch at for Father's Day at the Geelong Racing Club. We got a significant more amount of money. And then we were almost there, but didn't quite have enough. And the Rosemary Norman Foundation said, look, we think we can provide what you need to get you over the line. So a lot of groups, some with a lot of money, some with a little bit of money, but an awful lot of community support, which got this over the line. And, you know, the hospital was able to write out a check and purchase the whole thing. And it's up and running, and it's making a difference to the men in Geelong, more accurate, safer prostate cancer diagnosis and allows us clinicians to better direct the care of these patients. So this machine has made a real difference, and look, we're incredibly grateful to the support of the Barwon Health Foundation and every individual and every group that contributes to that. So thank you.
Thank you very much, Richard. And you've really summed up nicely the importance of collaboration in philanthropy, because, you know, from small things, big things grow. And this piece of machinery that's sitting right next to you is literally saving local men's lives. And am I right in saying, Richard, that you were sending patients for this type of non-invasive biopsy to Ballarat?
Yeah, that's something that irked us a little bit, not only because patients had to travel up the road to either Ballarat or Melbourne, but, you know, we're a sort of a leading regional health service. Our prostate cancer care, as I said, is really second to none in regional Australia, that we had to actually send patients, you know, an hour up the road to another hospital to have a biopsy because they had a machine and we didn't. It didn't make a lot of sense. So big difference.
It's wonderful news for Geelong, and certainly wonderful news for the men in all of our lives and all of the lives that are online here this morning. I've got a question from Glenda Ford, Glenda is a wonderful, long-standing volunteer at Barwon Health. Thank you for your question, Glenda. We miss you and we hope that you're all well. Can this machine be used for ladies with bladder cancer as well?
No, this is unfortunately, this is a machine just for prostate cancer. It's sort of a one-trick pony. This one, it's just for the diagnosis, and it's for prostate cancer, early stage prostate cancer, and the whole machine is sort of set up and constructed just for that. But look, we're actually doing some work in bladder cancer research, and it's quite likely, Zoe, you pointed out the Adrian Costa Clinical Trial Centre, where actually got a meeting at lunchtime today, looking at being involved with the oncologists with a major international research project here at Barwon Health with the Clinical Trial Centre for bladder cancer. We're doing some work in kidney cancer as well at Barwon Health, and you and I have been talking about a piece of equipment that we'd like to use in kidney cancer and for our robotic surgical program in kidney cancer, which will enable us to treat part of the kidney with kidney cancer rather than removing the whole kidney. So that's something else that we're looking into.
Wonderful. Thank you, Richard. And I've got another question here. How many people in the community have benefited from this piece of equipment so far?
Yeah, we've had it for about 10 weeks. We've done about 50 biopsies in that time. And looking at, you know, our experience with the previous biopsies, I would say that of those, probably 20 to 25% of those patients would have had a different management plan enacted because we've got a machine which can have greater diagnostic accuracy. And of course, they've all been treated safer because we use this machine. The risk of getting an infection after your biopsy is almost zero. Big change.
That is wonderful, and we're thrilled to be involved. And again, we thank Cancer Aftercare Group, the Rosemary Norman Foundation, the Gentlemen's Club of Geelong, the Geelong Racing Club through the Father's Day luncheon, and the Mailbag Foundation. This is a perfect example of the community rallying together to advance local health here in Geelong. So thank you so much, Dr. Grills. If you do have any questions for Dr. Grills, please post them in the chat box or raise your hand and we can come back to you. Now, I'd like to hand over to Claire Eates, who is our Community Fundraising Manager at the Barwon Health Foundation. Many of you who would know Claire would know that Claire's about to depart on a little bit of leave, and we are so excited to welcome our newest little member to the Barwon Health Foundation team. Claire, over to you. Claire, you're just on mute. Still on mute? There we go.
Good morning, everyone. Thank you for coming along this morning and attending. I've missed seeing so many of your faces and attending our meetings and our little chats. So I look forward to hopefully catching up with you early next year when hopefully things go back to a little bit like our normal. We thank those that have supported us in many ways throughout the year, those that have turned their fundraising to digitally. So we've had some virtual trivia nights and raffles, and we thank you for those that have completed them, and the people that have also supported with scrubs and hand knitted items and all those lovely items that, you know, are really appreciated by the staff and patients at the hospital. And a big thank you to those that have attended today, and we look forward to seeing you soon.
Thanks so much, Claire. And Therese, I've got a question here for you. You mentioned that children were involved in the development of the plan. How were they involved?
So in 2019, we were lucky enough that the foundation supported us to do a consumer co-design process with young people and families. So that meant we were able to meet directly with parents, with young people. I think our youngest participant was 5 and our oldest participant maybe was 22. And also siblings, and ask them what their hopes and dreams were for a new kids rehab centre. So sky's the limit. If you could have anything that you wanted, what would it look like? What would make it a place that you wanted to come to, that you were engaged whilst you were there, that made the journey safe and comfortable and that helped you along the way? And so we asked all of those questions, and we did lots of interviews and workshops, and we pretended that you know, what would Disney build? So we had lots of engaging conversations, and we were able to come up with a core set of principles, I suppose, about the co-design. And during all of the design meetings, my role was to advocate for that. So every second sentence was, well, during the consumer co-design, they said, and really wanted to make sure that this represented their wishes. We've been back to them twice with preliminary designs and asked them again, what's this like for you? What do you like? What don't you like? Will this work for you? So they've really been part of the process. This is for them. It's not for me. It's not for my team. It's for them. And it's really important that what we come up with reflects what they need. And I think we've been very mindful all the way along that this is community money. It's hard-earned money that people are donating for, which we're so thankful for, and our families are so thankful for, to make this journey just a little bit easier for these people. And so everything in this space is for maximum benefit for all of the participants. It's not about the office space for us or the equipment for us. It's absolutely every single thing in there is for the people who are going to come in and use it. And it's such, you know, we do talk about it with our clients as a big warm hug from the community. They're very mindful that it's money's coming from people like who are here today, who value them and their involvement in the community. So we're very grateful.
Thanks, Therese. And Kate, a question here for you. Restrictions and the hospital moving forward. When do you think things will open up in the hospital space?
Yeah, thanks, Zoe, and thanks everybody for that question. We've been very much guided by what the government have been communicating and what we've been required to do from the Department of Health and Human Services, and that's been very much directed by the epidemiology and the Chief Medical Officer and the experts that have been surrounding the Premier and the department in the decision making, which very complex decision making. And so quite early on this year, we wanted to give particularly volunteers some certainty about knowing whether we would or we wouldn't be recommencing any services. And so we communicated that really for 2020, we're not anticipating any face-to-face activity will be possible. And so as we come to the end of 2020, we'll be reviewing that and communicating. We're communicating monthly at the moment to volunteers to let them know what's happening. So that's a consistent message. And At the moment, we're being allowed to return to around 85% of service delivery, so in our theatres and in our community health, for example. And then we've got a roadmap toward going to 100% of that service. So at the moment, still there's visitor restriction, both in aged care and in the university hospital. And that is really about the same messages as we've had with the public health messaging. It's about social distancing. It's about minimising traffic and exposure to each other, particularly because we've got people who are in vulnerable health, both in all of our sites. So that will slowly start to change. We hear the word COVID normal, and so we'll start to see some of those things be revised. But we know that we will continue with those fundamentals, which is about social distancing and masks and those sorts of things. They won't change until we come to the end of this pandemic one way or another. So is that a clear enough answer, do you think, Zoe?
Absolutely. Thank you, Kate. And we've got a lot of volunteers online at the moment, and gosh, we are missing you dearly. And we hope that you're feeling engaged through the updates that Kate has been sending. I refer you back to the last update that was sent out. There is some digital volunteering opportunities available, and there was some expression of interest requested. So have a look back in your emails at the latest update received from Barwon Health, because there's some great information in there as well. But we do hope that you're all doing really, really well. We miss you, and take care of each other during this time. We do have a question from Ian, who is from the Rotary Club of Bayside. Thank you so much, Ian, for your question to Dr. Grills. Is this a painful procedure with the new machine, Richard?
No, so this machine's use is under general anaesthetic, so the patient's asleep. And look, after the procedure, minimal discomfort, usually Panadol. The patient goes home with Panadol the same day. A little bit bruise around the bottom, but it's not a particularly painful procedure.
Even better. Thank you, Richard. We've got a comment from Sandra. Sandra says, the rehab centre, from our own family experience, feels like it is ours for us. Our 6-year-old speaks at volunteer days, as do I, with ownership and pride. So thanks to all involved. Thank you so much, Sandra, for that comment. We really do appreciate it. And I'm sure Therese will take that back to her team as well. So if there's no other questions, that is a big overview of what's been happening at Barwon Health and at the Barwon Health Foundation. We are so grateful to Kate for the general update across Barwon Health and the insight into what's to come with the easing of restrictions and the restoring of services. Richard, we are so proud and so excited that we were able to contribute to Men's Health in Geelong by working with the community to bring together different organisations to fund the TBM machine. And Therese, we are so excited to be able to turn the first sod next year and build local kids a dedicated rehab centre as they so rightly deserve. Claire, thank you so much for all your work within the community space. To all of the community groups out there, volunteers, thank you for everything that you have done to help Barwon Health prepare for their response to COVID-19, but also everything that you've done pre and post COVID-19. I'm looking online at some of the names that we've got there. Scott Graham from Medimime. We've got Narinda, who does so many fundraisers. We've got Jim Mirandes and Joe White from Rotary Clubs, as well as Ian, and the list goes on. We've got Chris Hall, we've got Ian Hall, we've got Carol Thorpe, we've got Celia Fletcher, some fantastic volunteers. We've got Sean Witherton, who is a palliative care volunteer as well. Thank you all so much for being here with us. This won't be the last time you hear from us. Please share these messages loud and proud for an organisation that you support so dearly. But until then, we say thank you. We wish you farewell. Take care, stay safe, and please remember the health advice in protecting you and your loved ones. Bye for now.